economic, physical,
Yeah, but
spiritual, and mental
just
well
when we
being.
about
Just imagine you on 88.5 Sufra FM talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex,
Sex? Did you say sex?
as prescribed. Take your medication, exercise, and diet. On 88.5 Sufra FM, tell a friend, call your neighbor. Casualty 911 is on.
Good morning and welcome back to Casualty 911. I apologize for that long break. I am your host, Fawn Minviel, and now we have our guest with us so we can
for me, I cannot
finally
hear
get
you.
into the topic of today, menopause. Today,
Huh?
joining us is. Yeah. Today, joining us is Dr. Shael Durand, consultant obstetrician gynecologist, and she's going to share some of her knowledge about menopause with us. So, we'll be talking about what menopause is, at what age can we expect to have symptoms, what are some of the symptoms we may experience, and how do these symptoms affect the people around us? So, for example, our
Now you, I don't see the
partners,
volume, huh?
what what will they experience? How can they deal with it?
Oh,
Support? How can they support somebody who is going through
Mayu,
this? Good morning, Dr. Durand, and welcome to. You need to unmute your mic. Good morning, Dr. Durand, and welcome to today's edition of Casualty 911. We are just waiting for Doc to settle. It's one of those mornings, apparently. So, Dr. Durand, could you please unmute your mic? Well, while we wait, I will just start off by saying that, menopause, as I said earlier, is a period in our lives, is a period of transition, just as puberty when we are very young. So, as we get older as women, we have to go through another transition, which is the menopause transition. So, it's sometimes, women, we think about menopause as just, oh, yes, the relief of not having a period. But there's a lot more to menopause. And this morning, we will be talking about so much more of what it entails. So, Dr. Durand is going to talk to us once she unmutes her mic. Doc, can you hear me? Apparently not. Doc, can you hear me? I think we're still having some issues. We're still having some issues, so I'm just going to try to get it sorted out. Um, so we're talking about menopause today, that period of transition for women. And once we get Doc on, we will be able to discuss what the symptoms are. I think we're having an issue with the internet. So, okay, we've lost Doc, unfortunately. Maybe we're having some issues with the internet. I hope that we'll be able to get her back. I don't want to preempt anything that Doc is going to say. I don't want to talk about, everything that Doc has prepared for us that she's going to discuss. So I'm just going to wait a little while and see whether we can get Doc reconnected. So Our guest, as I said, is Dr. Shael Durand. She's a consultant obstetrician and gynecologist. She actually works at the Beaufort Wellness Center in the Sexual and Reproductive Health Clinic, which 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 is on every Tuesday at the Beaufort Wellness Center. She has been a guest on Casualty 911 before. I think that the last time she was on, we spoke about sexual and reproductive health. I was fortunate enough to be at a session not too long ago where she was talking about menopause, and that was very, very interesting because sometimes you don't expect to hear certain contributions from certain sections of our population. And some of those older people, they have a lot of knowledge, and sometimes the way in which they share it is it's just so, for lack of a better term, entertaining, because some of us were laughing away because sometimes just the way it's said, and the patois, when that come down in a patois there. All right, so I think Doc is back on with us. Can you hear me?
Wash our hands, particularly
Doc,
after
can
you
you
have
hear me? Good
used
morning.
before you're going to eat. We need to remember those little things so that we can reduce the risk of being
Good
infected
morning,
in
Dr.
that. For
Duran.
those
Can
people
you hear
who
me?
know that
Doc is
sick,
back on. I think she's
you have very
set up.
vomiting, you really should not
I'm
be
not sure if our
handling food.
audio is getting to her.
Often you may find that
Dr.
people
Duran,
who are
good morning.
infected, they are handling food, maybe raw foods like salads and fruits and sandwiches and so on, preparing those things. The hands may not have been washed properly, and so somebody else can
Good
get
morning, Dr.
infected
Duran.
in that way.
I think
Also, if there's somebody who's sick in the home, the vomiting is what we call projectile vomiting. So that's just sortir con force. Okay? So that means that when it comes out like that,
bring down line.
Imagine you're on 88.5 Super FM. Talk. 10 a.m. to 11 a.m. with the consultant. That's not merely the absence of disease.
Hello?
It is your social, economic, physical,
Yes, what?
mental well-being. Just
I don't know what happened. I cannot hear you at all.
experience, information, education,
No.
entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy,
Maisha! Aisha!
as prescribed. Check your
Come.
medication, exercise, and diet on 88.5 Super FM. Tell a friend, call your neighbor. Casualty.
Come. We cannot hear you. They cannot hear me. Come fast.
Hands clean is important for good health. However, after a disaster, staying clean is hard to do, especially if there is no pipe-borne water. Simple things you can do: stay clean and remain healthy are: wash your hands with soap and clean water. If these are not available, sanitizers with alcohol are options. Wash your hands many times during the day: before preparing food, eating, caring for a sick person or baby, treating a cut, wound, or sore. Wash hands after using the bathroom, changing diapers, caring for animals,
Okay, you hear me now without the phone?
handling garbage. Washing your hands is one of the best ways to prevent illness. For further information, contact the Bureau of
Yes,
Health
I can hear they advertise now.
La mwen pop se chine bon santé. Li absolument
Okay,
nécessaire.
no problem.
Mais on si oubli chen bon santé. Quand même, si ou pa ni glositen, ou sa fè se bagay sa la. Koute, lave la main souvent et puis glou net avec savon, après condition qui ka simen 20 minutes. Par exemple, si vous lavez la main après vous changer derrière part, servi très vite. Occuper moun qui blessé et bien malade. Après vous occuper les animaux et après vous enterrer les ordis. Et si vous pas ni glou, Ou sa sevi sa yo ka kouye hand sanitizer epi agron pou 30 secondes. Lave les mains souvent. Ça c'est une manière pour empêcher sous les points santé, numéro 468 avec toi 4
Good morning. Good morning, and welcome back to Casualty 911. We're
Good
having
morning,
quite a morning. With the
and welcome
technical
back to
difficulties, I am your host, Fawn Minviel. Welcome back, and we are going to try to get into our topic of menopause right now. Good morning, Dr. Durand.
Good morning. Good morning.
Oh, it has been quite a task getting us started here this morning, but I'm very happy that now it seems to have been sorted out. So, welcome and thank you for joining us on the program this morning.
You're welcome, and thank you for inviting me.
Okay, so in the interest of time, I think we will just get right into it. So, if you can tell us what menopause is, the age, the normal age when we can expect to start getting those symptoms. You know, sometimes when we talk about menopause, there are some women, they associate menopause with just one symptom, and there are a lot of symptoms. So
Yes.
I hope that today, once you have shared that with us, we'll have a better idea of some of the various symptoms that can arise during that period of menopause. So we'll talk about perimenopause, which is part of the whole menopause process. Menopause, the symptoms. We'll start off with that, Doc.
Okay. Thank you. I appreciate that. Good morning again, everyone. And as for present me, so I'm Dr. Shail Duran. So menopause is when the period stop for real from 12 months straight. So that means everybody know what is the menstruation. So is when you have your puberty, like for women, of course. And then it start from the age for now we record it from 8, 9 years old until the period stop. Even though you have your period stop about 6 months, 8 months, 4 months, and come back, that is not menopause. That is perimenopause. We talk about menopause is when you spend 12 months without any menstrual period, and then any vaginal bleeding or spotting. It can happen from 40 years to 50 years old. But for the USA, we can start from 51 years. So menopause is natural. So we will have some physical symptoms. We will have hot flashes, emotional symptoms, and then disturbing during sleep, loss of energy, and then affecting your mood. Unfortunately, that can affect your house, your family, your husband, your partner, your children, your work, because of the change of moon. And then your lifetime will change is because of the hormone disbalance, not hormone disbalance, but the hormone level. Everybody know what is the hormone in your during your cycle is estrogen and progesterone. So normally during the menopause, you will have you lost a lot of estrogen level in your system. So that is why you will have all those symptoms regarding like hot flashes and changing mood, etc. in your system, because normally your hormone level will be so low, and then we cannot balance it without because it's a natural cycle. But now, we can talk, we can base on the hormone level about 45 to 55 years old. So we have some medication we can have for menopause therapy. but is clonidine and gabapentin, etc. But remember, since it's a natural cycle, so we don't have to introduce all that in your system. Mentally, we can have the support of our environment first. So the cause of menopause is, as I said, is a natural change. But the other way too, we have a surgery that can cause a menopause cycle in your system. You can be 20 years, 40 years. For example, everybody know what is hysterectomy. Hysterectomy is when you have a surgery done and you have to remove your uterus, we call it womb for all those who don't know the medical term. And then is when we remove your womb. So that called hysterectomy. That can happen any age, 20, 30, 40, 50. Even though normally you're supposed to have your period, but because of the hysterectomy, you will not have any period from the time you have the surgery. So the most time you have a hysterectomy done is when you have what they call, but we will not sit on that uterus like after the hysterectomy. But I just want to make sure to make you understand. So what can cause you to be in a second period of menopause? So when you have the hysterectomy done, so is when you remove your womb. So now what will happen now? All your hormone level will stop, and then they will have no correlation, no connection between your womb, your cervix, your ovaries to have a flow for your blood. So the the hysterectomy most time is when you have like a hyperplasia. So that means is your endometrium is thick and you're bleeding a lot. So most time you have to do a surgery. You have to have a surgery done. Sorry. Or if you have uterus fibroid, everybody know what is fibroid. So brief. We will not sit on that. I just want to make sure to explain to you we can have a menopause period without like your age 50, 60 years. So I hope everybody understand that. So that means as soon as you have a hysterectomy, that means that can happen. You have all the menopause symptoms coming in your system. So you have to expect the symptom of menopause when you have a hysterectomy done. So now, what will happen now? Between the perimenopause, we will have it first. The perimenopause can last for 2 years to 8 years. That means the process to enter menopause can take from 2 years to 8 years. Remember. So remember I said from 40 to 50 years, you can have the menopause done. But from 2 years before the menopause happen, so you can have some perimenopause symptom. What will happen? You will have an irregular period, you will have a vaginal dryness, you will have hot flashes and night sweat, sleep problems, and then your mood will change. And sometimes you will have a trouble to find words. For example, it's not like Alzheimer, but will have it will be like a loss of memory, but it's not a memory loss. It's just like because of the hormone changes, and then you will have lost like find difficult to find words when you talk, when you're speaking. For example, even your children will laugh because if you have to call a name, you call another name, or if you have to announce something like you usually do, but you say another word instead to say the right word. So that can happen for menopause. It's normal. It's not because you loss of memory. It's not because you have Alzheimer. It's because of the hormone changes. The hormone changes will cause all that like for the brain, because you will say what is the correlation between the menopause going to your womb and then your brain. Of course, because remember everything coming from the what you call the hypothalamus, that means it coming from your brain, and the connection will go all the way from your brain to your pelvic. So when it's like a remote control. So that means remember everything, even your period, will happen is because your brain order it to happen. If your brain tell you, so okay, so I want this go to your pelvis. I want this to go to your ovaries. So that is a command. So that is why. So you will have a problem in your brain. But that doesn't mean, as I said, you have a mental problem or you have Alzheimer. It just is because of the hormone changes from your hypothalamus going to your FSH, LH, and the prolactin, plus the main problem is the estrogen level will get low.
Doc,
So
I just want to take a little.
sometimes
Doc, I just want to go back to that that whole idea of the not memory loss. Sometimes they call it brain fog. You cannot find the words. You cannot concentrate because that is one of those symptoms that people really do not associate with menopause. You would hear people talking about getting old. As you said, we might think we starting to have Alzheimer's very early and that sort of thing. So I really want
yes,
people to take some time to understand that there are a lot of other symptoms apart from hot flashes. And some women have even described that whole sense of not being able to get the words, or lose, or memory loss, difficulty concentrating, and the mood swings. Sometimes they say they feel like they're going crazy, like it's not
yes,
their own body. So it's like an out of body experience. So for those people who may have experienced that, you're saying that that is quite normal.
yes, that is
Yeah.
normal. Because that what I said again is natural symptom. We cannot, it's not something you can stop. And then instead for you to go crazy, you have to accept the reality and then say, okay, as it's normal, so let me try to accept it and then okay, live with it. And that is why I say I talk about the house, your workplace, and your children, because you need their support. Everybody, as you said, that in the beginning, people think is when you get old, you're concerned about menopause. But I would like the youth, the whole world know, is not about women, is including children, partner, husband, and women. Because the thing is, they cannot go through it without us, without the youth, without the children, without co-workers, without a husband, without the partners. So that is why I was happy when you said at the beginning, it concerns everybody. It's not only the women involved. So as you said, yes, the loss of work is not Alzheimer, is not like craziness. It's because of the changes of the hormone. So I would like everybody to understand that.
So some
Okay?
women have also said that they experience having very dry skin as a symptom, and I think that is one of the things that we just would not associate with menopause at all.
Yes. That is, and then the dryness. Before we go to the dryness, so I want to make sure people understand too, because the menopause is not when you skip few months and you say you are in menopause. No, you have to spend 12 months straight without the cycles. 12 months straight, not even 8 months, not even 9 months. So what we have to understand, we have to be careful. Sometimes you can be 50 to 55 and you don't see your period for 6 months, 7 months, 8 months. And then you say, okay, you safe. But that can happen. You get pregnant at 55, 54 years, and then once you think you're in menopause. Because the thing is, while the cycle changing, while the hormone changes, remember we can still have the ovulation going on. So that is why you, as soon as you did not see your period for a certain month, you still have to go and see the doctor to make sure you in menopause or not. That can happen. You in perimenopause, and in perimenopause you can still have your hormone going on, and for you to get an egg done, the conception can be done. Unfortunately, sometimes there are disappointments, because imagine the 55 years old with a big belly and then pregnant. So
Yeah,
you have to expect that.
55 years old,
So
enjoying life and thinking you're done with that. And
you're done with
what?
that, and then yeah. So that is the funny part in it, and it's not. It's very. That is why we make sure we make them understand 12 months straight. But also after the 12 months straight, you cannot see any bleeding, any spotting. As soon as you finish menopause, that's it. There is no blood have to come, no spotting, nothing like that trace in your panty. As soon as you realize any blood after your 12-month menopause, you have to go and see your doctor, because that can be an alarm for any other illness. It can be cancer, it can be tumor, it can be hyperplasia, it can be anything, because you have to be careful. As soon as you menopause, that's it. There is no no limit. Like, there is a limitation. So as soon as you in menopause, make sure to put in your mind you cannot see any bleeding, any spotting in your panty anymore. Unless now we can talk about the dryness of the vagina. The same way, when you first having sex, your first intercourse, you have some blood. Some people bleeding, even though it's not very active, but that can happen during the menopause as well. You can see a trace. It's because of the dryness of the vagina. So what will happen is, because the vagina is so dry, and then you can get cut during the intercourse. So that is why you have to go and see a doctor to see, because they can make the difference between the cut or if a bleeding active inside. That's very important to know.
Okay.
And then so I don't know if I can continue. So as I said again about the skipping period, we have to be careful, because sometimes when you skipping period, 6 months, 7, 8 months, you better go and get a pregnancy test done to make sure he's not pregnant, you're pregnant. Even though you're 58, even though you're 60 years, as soon as you're in perimenopause, that can happen. You can get pregnant during this period of perimenopause, unfortunately.
And also, Doc, since we're on the topic, on the issue of pregnancy, we also have to let people know that, they need to be cautious as well as it relates to sexually transmitted infections. So if
Yes,
you
I'm coming to that. Yes.
yes, so, if you're not in a
Yes,
state
I'm coming to that because
relationship. So Doc will tell us a little bit more about, why it's important and what we can do in terms of safeguarding our health.
yes. So I'm happy you come with the subject, because I wanted to move on it. That is why, because regarding the vaginal dryness, because first of all, you will be exposed with more yeast infection because of the dryness. Remember, in your vagina, you have some barrier bacteria who protect that there to protect your vagina. But unfortunately, when you have the dryness, so this barrier is damaged already, because it is not there to stop the bacteria. So those women, unfortunately, will experience a lot of. They will complain. They say, "I'm not even sexually active, and then I have yeast infection and this and that." It's because of the dryness. So now, as you said about the other infection, the STI, thing like that. So I know when you in menopause, you feel free. You say, okay, I'm going free. I don't have to have any protection, any. and we will not use condom, anything like that. But hence again, even though you're in menopause, that cannot stop you to get any disease, any sexual infection transmitted. So you still have to protect yourself. You still have, if you're not, both partner not safe, you still have to go and see and go for your checkup and protect yourself and to use condom. It's not only for not getting pregnant, you have to be careful with menopause. Also, you have to be careful for the STI and STD as well. I have patients 80s, 90, 88, 70s who get sexual transmitted disease and sexual transmitted infection. So we have to be aware of that. So remember, menopause that doesn't mean you have a freedom and to go ahead anytime with anybody in anyhow.
Okay. So, Doc, you said you have patients in the 70s and 80s. Generally, we like to think that after a certain age, especially after menopause, maybe that people just stop having sexual relations altogether. And, because of
Yes.
menopause, sometimes there are changes to the libido. Sometimes people have low sex drive. But the changes could also be that they have an increased drive. Who knows? For some people, I've heard some people say that they have an increased drive after menopause.
Yes.
Um,
That's why we said symptom, because that doesn't mean the dryness is for everybody. It's the same way when you have because even though we say about the symptom of the menopause, that doesn't mean you have to go through that. The same thing with your menstruation. You can have your period, you yourself have no symptom, you just see blood in your panty. But they have many 100 plus symptoms of menstruation period. So that will happen. Some people have headache. Some people have feeling for sex before. Some people cannot see anybody, their partner, when they are period. Some people vomiting. Some people have a heavy period, pain on their abdomen. Some people have dizziness. All symptoms for menstruation period. That's the same thing for the menopause. So that doesn't mean all that I just mentioned. You have to go through this and then you say, okay, you're in menopause. That can happen too. As you said, the libido can be high during this period. Because imagine for your youth, you never be hot, and then during your menopause, and it's then your hot cycle will come. So that can happen. That is why I said we have to be careful in this period, because we think we are free to do anything, anyhow, and anytime. So or with anybody. So we still have to be careful about the consequences of the STI and STD,
oh,
because the SRH clinic is not only for youth, it's for all women and for all men. You know you sexually active. Okay, so
okay.
I don't know if
Yes.
you
So
okay with that. Yeah.
I know that we don't have a lot of time left, but I would like to speak a little bit about, our technical difficulties set us back a little bit. So I would like to speak about the people around us. So particularly when it comes to the mood swings, the changes in sex drive, and the loss of concentration, and so on. How can the people around, so for example, a partner, members of the household, how can they support somebody who's going through perimenopause and menopause?
Okay. First of all, that is why I said the subject have to be for everybody. First of all, they have to be aware of what is menopause. They have to be informed. So because the woman in herself don't even know, far less for household and the environment, in her environment. So it's best for everybody to know what is menopause and to bring the support. I know for some reason in bucket, I know for some reason some women will take advantage of that to say, oh, you don't know I'm in menopause, so because they want to, they want to act freely, to pretend so they forget, or to pretend like they don't want to have sex with their partner, all things like that. Because some of them will tell you, don't touch me. So, and then we don't want to dwell in that and to say, so he have to be this way. But the understanding of your partner, your children, your co-worker, your environment is very important. For example, even though you want to say, oh, so you cannot find it, so your environment can even help you say, so is this one that do say, so but he's not laughing or saying like the person going crazy. You have to bring the person support. And then for the partner too, even though the person say don't touch me, or she's not in the mood to have sex, but they have some affection, some other affection way you can always approach your wife or your partner, your girlfriend, to make her have a feeling to be a good companion. That doesn't mean he have to be sex, but you have to understand she going through a lot at this moment, and she cannot tolerate the intercourse now. So that doesn't mean you have to pull out instead for to approach her to make her understand. So I understand is because you're in menopause, but I am patient. So don't worry. So we will go. So I can accompany you through to go through this, and then we can work together. So all that, and for the children as well, because sometimes they cannot understand their mother. They even go like out to get some love instead to understand and to be there for their mother, because that can happen at this moment. The noise, you play a music that bother her, that's she cannot tolerate the music, because she usually play music in the past, but for some reason during the hot flashes, she cannot even tolerate anything playing in her ears. So she can be sensitive with anything you're doing. Even you do wash dishes, so the noise can disturb her. So that doesn't mean you have to quarrel with her and to say, oh, grandma, no, or she getting old. No. Contrary, you have to understand and to bear with her, and then to make her understand what she going through is normal, but you are patient to tolerate with her. So, and then for the environment, I know it's difficult, like for a workplace sometimes, because imagine sometimes it can be not only you going through menopause, because the other one go through menopause may not understand the one who have symptoms, because they will think it's a pretext. But no, I think if the menopause women have the environment support, life can be easier for her to tolerate, to accept the menopause symptom, and to accept the life changes.
Okay. So basically, it's very important for us as women to be able to identify, to recognize when we have started experiencing symptoms, because we need
Yes.
to know that we have started. And it's also important for us to communicate with the people around us, communicate with our children, communicate with our partners. I guess some people are very private and they may not want to say it at the workplace, but as you said, we spend so much of our time in the workplace. It might not be a bad idea at all to let people know that, well, yes, I'm going
Yeah, but since that is why I tell you it's a normal cycle.
experiencing.
Yeah, that is why I say it's a normal. It's not something you have to hide or you have to be ashamed, because that can happen. Contrary, as you said, since you spend most time in at your workplace, so it's best to say, I don't know what's going on, but I feel like my life changes. You can even like express yourself about your home, like to say, I don't know, for some reason last night my husband wanted to, I just couldn't tolerate my husband. All that can help you. And you just never know, one or two people experience already can even support you with that and say, oh, you know what happened? Probably menopause you're going through. So that is why communication is the best. You have to communicate and express yourself about what's going on. And then about the sleeping as well. Imagine sometimes you can go and sleep in at 10 p.m. and from 2 a.m. already you get up. You couldn't you and you nothing can make you sleep back. So that is why during the day too, you can be very upset and your mood changes because remember when you lose your sleep, that make you very upset and angry for anything. So all that that is why you have to communicate for people to understand. So okay, last night I did not sleep well because it's nothing. You don't have pain. You just cannot sleep. And then the giant. I want to because I know we don't have time, but also I want to mention about the incontinence for your urine. You will go through like you will feel like you cannot hold your pee. You laughing, you pee on you. You scream, you pee on you, or you do a very strong movement and then you pee on you. So all that is normal is because of the hormone changes. And then that is why too that part of the infection, the frequent infection you will have too during the menopause. Because the thing is, remember, during you cannot hold your pee for long. Your bladder get full for any time. So if you don't have a proper hygiene, so that can happen, you will get infection very often. So that doesn't mean like you have a problem and you say, my goodness, I cannot hold my pee, because you will be very sensitive about that. That is why you can even feel ashamed because you wet yourself for nothing. And during the night, by the time you get up to go and use the washroom, you pee on you already. So that is very important to know. And then the people who very addicted with coffee. So we have to avoid that during the menopause, sorry. Because remember, the coffee is helper for you to be awake. If you already have a problem for your sleep and then you take coffee again, so first of all, it will not be good for your heart, because during the menopause, so one of the complications is heart disease. So you can have a heart problem. That's one of the complications during the menopause. That doesn't mean you have to get the heart problem. I say is one of the complications. So that is why we have to avoid coffee, because that can affect your heart problem, plus your sleep, making your sleeping problem worse than it used to be.
Oh, I've never heard about the coffee.
Yes.
So thank
You
you
have
for
to
that.
avoid those things. You have to go through more protein, and then the weight too. So people will gain weight during the pregnancy because you will be so lazy. The exercise you used to do, you cannot do it again. And then everything will make you tired. You have a fatigue. So, and then you will eat very often, and you will feel hungry. Okay, often. So all that can make you gain weight. So that's why you need the protein, and then you need so to help for the menopause, you need to get more calcium, protein, magnesium, and the centrum silver is very good for the 50 plus. And then the magnesium can help you for the sleep, and then you can get D3 and omega-3. So all that is very important during the menopause.
And is there anything that women can do to help with the peeing issue, the not being able to hold the pee? And
Yes, so what you can do, you can have again go and see the doctor, because sometimes we have to make sure it's not a yeast infection or a UTI, to give you some antibiotic, and then you have to drink a lot of water, coconut water, just to make sure to help your bladder and your kidney to go fine. That can help you for the incontinence.
okay. And in terms of the sexual lives, the dryness for those people
The
who have
dry,
the dryness, what
okay, the dryness, you can use because it's easy to think so, because you need to masterize your vagina, because that will affect the partner for you, the man. And then I want to I know some men listening, because I would like, before I answer you, I would like the men to be more patient and more tolerant during the dryness, because some of them, when their libido go, like their phantasm so go, so they don't care about what the woman going through, and they just do the penetration so rough, and then that can give the women some cut. You have to be gentle, and more cooperate, more patient, more smooth than ever when you're having sex with a menopause woman, especially the one with the dryness vagina. So I would like to invite all men to be more gentle and more patient during the intercourse, because it's on depend on the way they having sex with the women. Now you can use the some lubricant. It's very good. It's not any, and please don't use Vaseline. Vaseline is not good to put inside of your vagina, because a lot of people, unfortunately, that's what they think. Because
Yes.
yes, the Vaseline is good for skin. I know it's a good moisturizer for skin, but remember, I said again, your vagina need some very protection antibacteria. So that is not the good one to protect your vagina against the bacteria. But there are some special lubricant. You can go to the pharmacy. Feel free. Don't be ashamed to go and get it done. Your partner can get it for you, or you can go and get it. So before sex, you can always rub it, your vagina with it, and then and then it can help you with your libido to get better, and then you can get wet. So when you're having sex, so nothing is forever. That doesn't mean because you have a dryness and then you see your last sex is done. No, any age you can still having fun during sex, but you have to know, as you just said, you have to know, you have to be expressive and not to be ashamed to communicate your feeling and your problem and your issue. So the lubricant is very good for that, for the dryness.
And you have to be organized, because if you know you have that issue, you have dryness, you just don't go and put yourself in a situation where you might end up. You must have it available so that you can.
Available for you, because you can get a cut easier during sex if you don't use it. Yeah.
So thank you, Doc. I'm going to try to do a little recap. So we know that menopause is a period of transition. We cannot say that we are in menopause unless we have been a full 12 months without any bleeding, spotting, and the perimenopausal period can be very, from 2 years to 8 years, Doc. 2 years to eight
Yes,
years.
8 years. Yes.
There are a lot of symptoms associated with menopause. Some of them are physical, some of them have to do with our mood, some of them have to do with the way we function, the brain, the memory loss, the loss of concentration, and so on. And as Doc said, the fact that she probably listed quite a few symptoms does not mean that every single woman will experience every single symptom. So some people, just as with puberty, some people may breeze through that period. They may not experience any, big issues and not many symptoms. And some people may have a whole big bag. They may have the hot flashes, the dryness, the loss of concentration. They may have a whole lot of symptoms. And as we have said, it is important to have support. It's important to communicate what you're going through to. So everybody around you should know about menopause so that they can understand what's happening to you. They can provide the support and you yourself know what you're going through. Because sometimes, Doc, honestly, before I actually started reading about menopause, the only thing I used to hear about menopause was hot flashes. So you just see people fanning, oh, macho, macho, macho. And
For sure.
that's
Yeah. That's the most common, because they will say the hot flashes is very, because you can be, everybody can be okay in the room with fun and AC, but you yourself, you just cannot tolerate you cannot tolerate. You feeling so hot, and then that is why you will see those women will wet their hair often. So go under the shower, and to have a nice shower, those people very, very often during the day, they will wet their head. So they feel more comfortable and get relief about it. And then one thing again, the bone. So with the menopause, your bone will be very, very sensitive and easy to get any fracture. Imagine you can fall when you are young, nothing happened to you. But a little fall you have during the menopause, you can have a fracture and you break your knee, your bone, your leg for anything, because your bone gets dry. That is why I invite you all to get some supplement that can help you to replace that to replace not replaced, but to help you with the estrogen level that low, and then that can help you to have, like, because the estrogen is so low in your system. That is why your bone is very, very, very thin and weak. Anything can break it. So the calcium, the D3, the magnesium, all that can help you to with your bone. The bone problem is a very important issue for everybody to know about it, because you can get fractured anytime and easier. I
Thank you
want to
so
make
much,
sure.
though.
Yeah.
Unfortunately, we cannot continue the discussion. I would love to, but we are way past our ending time. Thank you for joining us this morning. I really appreciate you making the effort to be here with us today. And I think it was very informative. And you are always welcome. I may be reaching out to you again at some other point in time. Thank
Yep.
you so much for joining us, and thank you to all of our viewers and listeners for tuning into Casualty 911 today. I hope you were able to learn something about menopause today. And I
Okay.
look forward to you joining us again for another edition of Casualty
No problem.
911. Thank you, everyone. Bye.
Anytime. Thank you too, and you're welcome. Bye. I don't know if they don't mind, they can leave their question on YouTube and Facebook, so I can reach out.
Wonderful. Wonderful.
Okay. All right. Thank you.
Bye.
Bye.
Casualty 911, 10 a.m. to